You want to demonstrate it?
Sure.
Go ahead.
Do limbo underneath this mic.
This is a live demonstration of the world's greatest stretch.
So wrists under the shoulders. Bring the foot up. This
Yep.
is a modified version of it. This is typically what I do.
Yeah.
And then from here, slide the arm across the chest like you're pulling a bow and arrow. Look with the hand to get that chest and shoulders.
Hey, look at that thoracic mobility right there.
And if you wanted to make it a bit more advanced, just get that back leg up.
Getting me excited.
Right? All right.
Right.
All right.
Do the other side. Let me see both sides. So
I don't know. Let's get
do the other side while I introduce the podcast. There you go. What's up, everyone? Welcome to the first episode of the Art of Wellness podcast. Episode 1, like I said, this is Danny Gustin, personal trainer extraordinaire. I'm Dr. Gerry Robles, doctor of physical therapy. And we're going to talk a lot about, jiu-jitsu, warm-ups, rehab, wellness tips, knocking over books, all that good stuff.
get it out of the way.
Yeah. You don't like that book anyway, so.
I like that book, but I told you my personal story with, I'm pretty sure I tore my labrum.
That's right. Yeah.
Doing the kettlebell external rotation joint mob.
Yeah.
So, where you take the kettlebell, you're lying on your back.
I forgot you told me that. Yeah, that's right.
And it was crazy. Like I'm doing that and, just kind of doing it as described in the book with the kettlebell.
Mm-hmm.
I just feel this super, super sharp pain. And you've probably been hurt like that before where you just know this is a different type of pain.
Yeah. Never in the shoulder, but I've heard a lot over the years. Yeah.
Yeah. So it was just, as soon as it happened, I just felt, oh God, that wasn't a normal muscle pull. So I'm pretty sure I tore my labrum doing that.
Right.
Because ever since then, that's when I started having issues in the right shoulder here.
Yep.
So I don't want to cast blame on Dr. Starrett, right? Because obviously he's helped so many people, but for me, there was so many good things I did get from that book, but I am certain that was an acute moment, right, where that happened. So there's that, right? But other than that, there's obviously a lot of good stuff and good content in that book, and he's basically the godfather of self-mobilization techniques, rolling techniques, right, and making that popular. Who else was talking about rolling into a tennis ball and lacrosse balls before him? So he obviously is a legend, right? So I don't want to say anything bad about him, but
I think he was definitely at least for a jumping off point for, rehab and sports med. His book is a good basic template for an introduction to those things, like you said. So it's very easy to read too, very easy to follow. A lot of basic steps in there, but it's better than not knowing what to do at all. You know what I mean? So,
exactly. Yeah, absolutely.
You had surgery too, right?
Mm-mm.
No? Okay.
No, I'm going to hold off on this. So, the good news is that there is many things that I can do to improve upon, right? I feel like one of the things that is frustrating is you're dealing with some sort of pain, whether it be in your knee or your shoulder or this or that. And when you're evaluated, you're great.
Yep.
Right? You're super flexible. You're super strong. It's like, well, crap. Where do I go from here? Right? It's time for surgery.
Right. Yep.
Right? Whereas if you have some sort of dysfunction like me with my labrum, when you helped me, it's, even though it can be discouraging on one end when you realize, oh, wow, I have no posterior stability in my shoulder.
Yep.
Like when you did that test where I'm lying on my chest, sticking my arm out, and you just push down a little bit, and it's like, right?
Yeah.
So even though in that moment it's discouraging, like, wow, I'm a weakling, right, in that particular way.
Yeah.
But it's encouraging because you're like, okay, obviously if I address that, it's going to help, right? Is it going to make me not have a torn labrum? No. But is it going to help insulate that area, provide more stability where I need stability to get me 90% function? And at that point, do I need surgery if I have 90% function, right? So, yeah.
You just opened the whole can of worms with, that's a great topic to talk about is, well, kind of backtracking first, saying all the tests I did, as physical therapists, we find impairments within, the certain, whatever patient we're dealing with. And, a very basic template we follow is when you address the impairments, the pain dissipates and function improves, essentially, right? And we found whatever impairments for you, we addressed them and we got better at it. So it's a very basic physical therapy template. It's the one, they teach us in school, but it's still, the basics never go out of style. So
they're the basics for a reason,
and
right?
a lot of people don't even know where to start, in terms of like something hurts. What do I do? Where do I go? Who do I talk to? And there's so much stuff on the internet that, confuses everybody. So,
exactly.
And I think, part of my job is to, within our community is at least to tell them first and then get the word out as much as we can. But, well, back to your shoulder though, you were talking about, rehab that we did. What do you think helped in terms of, building your shoulder stability, building strength, and improving your function, like stuff we did in the clinic?
I think what I learned then and then what I've built off since is my thoracic mobility was trash, especially on my right side because that's where all my scar tissue is.
Yep.
So I had a surgery when I was 18 months old to remove a cyst from my right lung.
That's what I was thinking of.
So there's a huge scar running along my shoulder blade, starting from like my neck to like my shoulder blade, right? It looks like a moon, almost a crescent moon. And so as a kid, I didn't really notice that. But when I started lifting weights and getting more into athletics, that's when I started noticing, oh, wow, my left side is developing and functioning totally different than my right side. And so I think just over the years, not being aware of what I could have been doing to be more proactive, I just let certain things ride because you're young and who cares?
Yep. Exactly.
Right? And so working with you, I realized, wow, my thoracic mobility is really jacked up. And then also my posterior stability in my shoulder, like rear delts, periscapular muscles, all that stuff was so weak.
Low trap, all that good stuff.
And so unstable, right? And so how can I do 6 chin-ups with good form, but then I can't hold my arm out for 5 seconds 10 times without my shoulder going like this, right? And so obviously that's a huge deficiency.
Right.
And so again, I think in the moment it's easy to get caught up in, oh my gosh, I'm so weak. What the heck? This is BS.
Right.
But then again, it's an opportunity because if you address that kind of stuff, well, will it take your pain or whatever dysfunction you're experiencing from 50% to 100%? Maybe not, probably not, especially if it's a structural damage that's been done. But heck, 90%, 80% is a heck of a lot better than 50%, right? And then from there, you can make a better judgment call of what you want to do next if you've maxed that out.
Right.
You know what I'm saying? Like, and for a lot of people, 80, 90% might be enough to ride it out for the rest of their life. Maybe if you're an elite athlete, that's not okay. You need to get to 100%. And so you got to go the surgery route. But
even then, going the surgery route, I've seen clinically, working my 6 years as a therapist, a lot of times an athlete gets the surgery, they get full range of motion, they get full strength back, and that pain is still there. And I'm like, man, that sucks. They were so frustrated in the beginning with that pain, and it's still there after surgery. And we did everything we could in therapy, in the clinic, and that pain is still there. And that's where the whole, the pain science discussion of the structural and tissue damage, how does that relate to pain? Or does it relate to pain? I'm sure it does, but at the same time, we can't always be like, oh, this is torn, that's why I have pain. A lot of times people have, as we've talked about this a lot, as long as I've known you, like, the whole, let's take back pain, for instance, people have herniated discs, and they have no pain, or vice versa. They could have nothing structurally wrong in their back. They've taken images, MRIs, x-rays, all that good stuff, and then they still have chronic pain. And that's, a whole nother discussion we could talk about later, but to kind of, talk about that deeper, but they'll take forever. So we'll come back to that as we go. But
it's a great point, because why can person A have mild arthritis and they're like hobbling to get up and down stairs? and person B has severe arthritis, and they're running around doing whatever they're doing, lifting weights, right? It's obviously a reality, right? It's going to make some impact for certain, right? But there's so many other variables. And again, you were one of the first people to introduce that idea to me, where it's like, it's not as simple as, this cause leads to this effect, right? It's multifaceted. There's a lot of factors, like you've said, stress, sleep, right? Your general attitude at that time, right? Of course, how you're eating, a lot of stuff. Of course, physical therapy, exercise, making sure the muscles are supported, but there's so many things, right?
Yeah, and that's, the whole point of this podcast that I wanted to start was to, like you said, health and wellness is multifactorial. The biopsychosocial model of medicine and healthcare is something that should be emphasized more, I think. And I think, there are some people that talk about it, but, still in the mainstream, it's like, my shoulder hurts, I have a tear, period.
Yeah, and I can't do jack until that's fixed.
Yes, exactly. And, people
My best days are behind me, right?
Yeah, and it's true. And people don't even know that they can try rehab and therapy with a physical therapist first before even trying anything drastic like surgery, because surgery is trauma. They're opening up your body. They're rearranging some stuff. Sometimes your body won't like it, and it'll lay down more scar tissue than anticipated. You'll get more pain afterwards. I'm not saying never get surgery.
Sure.
But, it's a nuanced discussion that's individual to the person. At least try other things first before rushing to, me hurt, my back hurt, I have herniated disc, take it out, I'm better now.
Yeah.
Which, it happens, but at the same time, I've seen it, the other way where they take out, the structural abnormality and they still have pain.
Yeah.
So, that right there shows me in person, in real time, like, hey, pain is more than just tissue damage.
Yeah. And I also think it makes sense, I think, in almost all areas of life, but especially with this. You should try to solve any solution with as little force as possible, right?
Okay, yeah.
And so surgery is obviously the extreme in many situations, right?
Yep.
And so if you can do something like physical therapy or basic exercise, whatever, right? And spend 12 weeks doing exercises, stretches, whatever, that are targeted at addressing the dysfunction,
right?
Why wouldn't you do something like that first before opening yourself up to trauma?
Yep.
Right?
Yep. And I always tell people, the only side effects of physical therapy, my pill to you is exercise and prescribed movement. We're the doctors of prescribing exercise and movement. So the only side effects are improved flexibility, decreased pain, and increased strength. Those are all good things.
Yeah.
At least do that first. And if you still feel like, it's not helping or whatever, of course, I'll go with you. I go with my patients to go see whatever specialist they want. You know what I mean? A back surgeon, shoulder surgeon, specialist, whatever. But like you said, let's exhaust all avenues first.
Yeah.
Before diving into extreme medications and surgery, like that shouldn't be our first thought that goes into our head of, my foot hurts, I need foot surgery or something. Or I had an x-ray on it, my bones look a little weird.
Yeah.
My back is a little curved this way. That's why I have pain. It's not, most likely.
Yeah. It's like if you're afraid of dogs because you got bit as a child, maybe give someone a stuffed animal dog first before you are like, hey, we're going to deal with this head on, and we're going to surround you by 20 dogs, and you're just going to overcome this. It's like, well, maybe just like take it one step at a time. Mm-hmm. Try like more gentle approaches to dealing with the issue first. And again, I think, don't you think some of that is just born out of the fact that people want the easy fix? They want the magic pill, which is, it's crazy because if you look at pictures of surgery, right, it's anything but easy fix, right? And again, I'm not bad-mouthing surgery. Obviously,
no, we're not at all.
It's been, joint replacements in particular have helped many of my clients, right? Including my dad, right?
Yep.
But it is very traumatic, right? And I think sometimes people just think, oh, well, I'm going to go under and I'm not going to have to think about it. And then
I'll be fixed.
And then I get to relax and not work for a week or two. And
the funny thing is,
it's a vacation, right?
Yeah, after they get surgery, they need physical therapy anyway.
Anyways.
So, but some people don't even get some specialists don't even say go get PT after your surgery. They don't know what to do. I had someone call me yesterday who just had a total knee replacement, and he was like, the surgeon didn't even say anything to me. Like, I know I need rehab. He mentioned it once, but like, where do I go? What do I do? And, I think like a friend of a friend gave him my card a while ago.
Yeah.
And he saw that it said physical therapist on there, and he just called me randomly. And I'm like, I had to walk him through the whole process of what to do after surgery, which is fine. I'm more than happy to do that, but it shouldn't be like that either. You know what I mean? Like, it's not just like surgery, you're fixed, go figure it out on your own.
Exactly.
We're in healthcare. We're supposed to help people out. We're supposed to be a team to help the patient, the person who's in front of us. And a lot of times I see that it's not as streamlined as it should be.
Yeah.
And, it's really weird to me that he had, and I've had this a lot over the years where people call me or people ask me, like, what do I do after surgery? Like, and I asked them, like, did nobody explain this to you, the PA or the surgeon or anybody? And, not all of them do this, but
yeah,
I've heard it too many times where I have to, talk about it. And like I said, I'm more than happy to explain it to them, but at the same time, it's like, don't just leave the person to go fend for themselves. Like, that's not healthcare to me.
Yeah, I'm with you 100%, and you'll get a kick out of this. So my knee issues started probably when I was in my late teens, because I started getting, I think it's referred to as a shift and pivot injury, where, there's too much torque on the leg, and instead of it happening with the foot or the hip, it happens at the knee, and so the knee just kind of pops and then comes back, right? And so I started doing that, eventually tore my meniscus, eventually had to get a meniscus. Well, I don't know if I had to, but I got that, right? I ended up getting a meniscectomy. They just partially removed some of the meniscus tissue. And so I go back to the orthopedic surgeon who worked on me.
Not my favorite surgery, by the way.
Right? Right. Almost, I've heard that it pretty much guarantees arthritis at some point, right? But so I go to him, and he's evaluating me, and I said, hey, like, what do you think the next steps are? He goes, well, let me see something. And he basically just had me like extend my leg and then just push down. And he's like just pushing on, and he goes, sounds like you're good. And I'm like, oh, okay. Well, I'm good then. Nice. But then that began the next decade of me having knee issues, and I guess being ignorant, or again, maybe young and like lazy and just not prioritizing it. But I'll just work through this knee discomfort where, who knows, I have some damage to my knees now where I have, severe arthritis in my right knee. I wonder if back then, if I just took that more seriously, worked with a physical therapist, addressed some of whatever, obviously I had a perfectly strong leg because I could do this for 2 seconds.
Yeah, in an open chain
against a weak surgeon.
Yeah, but maybe like in a closed chain exercise, it might have hurt more, like a loaded squat or something. This might feel good.
Yeah.
But when you're trying to do squats in the gym or something, it might feel like crap.
Yeah.
So.
Well, don't you think in some ways, when you're dealing with surgeons, obviously there's incredible surgeons who are obviously to go to school and do what they do. That's incredible dedication, intelligence, etc.
Yeah.
Right. And there's so many people who have made an amazing difference. But I think you also have the horror stories where you hear about someone who they're too concerned with just getting you to be walking practically.
Yep.
It's like whatever this basic baseline of being a human is. They're like, well, you can walk, so it's good now. And it's like, but I want to do so much more than just walk in my life, right?
Yep.
And so, but that's where you need a full approach.
Yeah, the full, if you want to call it holistic approach, whatever it is. I'm only one side of the approach as well. On the physical side, I'm a physical therapist, but there's the whole mental side of it too. You can't ignore that. It's two sides of the same coin.
Yeah.
So, whether it's someone in chronic pain that I'm helping, we're going way off of my outline, but it's all good.
I told you is that we didn't need the outline.
I didn't even I'm not even going to look at it.
You're like worried about an hour going by. It's already been a half hour.
Yeah, but people in chronic pain, like a lot of times they have depression, anxiety, a lot of mental health things that I'm not the expert in.
Yeah.
But I would refer to whoever I trust in that field to send that patient to, you know what I mean? So you can't ignore those things. It's someone has a lot of pain, they start getting depressed, or someone's depressed, they start having physical pain. It goes hand in hand. So, but healthcare is rough for people, and I hate hearing it. I've heard it way too many times over the 6 years of being a PT, but
well, and there's enough for everybody,
right.
right? And I think that sometimes the mindset, I don't think probably surgeons and people in the like big healthcare worry about this much because they don't really have to hustle or anything like that. They just, people go to them because of insurance companies, but people in more cash-based practices like massage therapists, trainers, some physical therapists, chiros, etc. There's a little bit of that hustle mentality. You got to really work for your clients kind of thing. And I think sometimes people can get caught up in that idea of, oh, you don't need to go to a massage therapist because you have me, or you don't need to go to a physical therapist because you have me, and you don't need this or that, right? There's enough for all of us, right? And if we're just prioritizing what's going to be best for our clients, everything's going to work out, right? Because even if maybe in the short term that means they're not working with you for a period of time, they are going to trust you long term because you were willing to say, hey, we've gone through the options that we could have within my scope of practice, right? And so now we need to look elsewhere, right? And obviously they'll know you had your best interest at their heart and you found them the person or information they needed to get better, and it's going to come back to you one way or another, right? And so I think that's part of it too, is we just all need to know our different roles in the healthcare continuum, especially what I would call like the proactive healthcare continuum, right? And not that physical therapists don't deal a lot in reactive stuff too, like after the fact, but I would love it. I know that's one of your visions, right? Is just kind of revolutionizing the idea of how that continuum works, right? And how we all interact, and I'd love to see that too.
Yeah, definitely. And having more things more streamlined for the client, the patient, whatever you want to call it. It's a person in front of you that needs help. Yeah. And again, like you said, if I've done everything I could, not that I would, ever stop seeing them. I'll always check up on them. But maybe, like I've sent you people before, like at that point I've decreased their pain. The range of motion is good. They're more functional. I'm like, hey, Danny could take them now. Yeah. You know what I mean? In the personal trainer realm of doing more whole body stuff or whatever. Not that we don't do that as well, but.
And then I can break them and injure them and give them back to you. Right back to and it's like this really good cyclical business thing.
Vicious cycle continues. Hurt them on purpose and then just. No. But,
last podcast episode.
That's our business model. Right? You heard them, bring them back to me. No.
Oh, I shouldn't have said it on live, whatever.
Live something.
Live something.
Whatever avenue we're putting this on. Yeah. Yeah. But yeah, it should be more, like you said, of an emphasized team. The healthcare team is everybody. Yeah. Including you guys, anybody. I sent people to massage therapists, to trainers like yourself, strength and conditioning people. I've sent people to, therapists, mental health therapists, stuff like that, because they need all that help from all different angles when it comes to their pain that they're having or their struggles that they're having. But
not that you need to get too into the details of that, obviously, for privacy's sake, but when did you HIPAA, right? When did you realize with someone you were working with that they needed like actual clinical help as far as like mental help? Because that's something I've had clients before that I thought they probably could benefit from navigating their anxiety, or what I at least perceived as more anxiety or more whatever than the average person, but that's not my wheelhouse. Right. And, I just try to be a good friend to them while I'm in that hour. And I've never really needed to push into that too much. But when did you know with this person or people that it was something that was needed to be explored?
Yeah. And again, it's not my wheelhouse. It's none of our wheelhouse. You know what I mean? But at the same time, it is within, in school, they taught us you could do like a little screening for it, or at least explore it with the patient who's in front of you. Sometimes they'll bring it up, and be like, I'm not feeling myself or whatever. And then you could kind of be like, hey, I know somebody, here's their card if you want to talk to somebody else besides me. You know what I mean? Not that I don't like talking to you, but I love talking to everybody. But, at the same time, if you're not feeling yourself and you've already maybe had therapy before and you've tried it, you want to try somebody else. Yeah. Here's the card of somebody that I trust. Maybe check them out. I'm not going to pry any further, but, like little screening questions here and there, as well as, giving them the contact details of somebody that you trust, that, at that point, it's up to them if they want to explore that that option that I just gave them. So, but
Yeah.
yeah,
So that it was just one of those things where it was a little bit more
yeah,
like, hey, here's somebody's card, or it wasn't like you were obviously pushing them necessarily, more
no,
just letting them know that, hey, this is an option if you want to explore it.
yeah, and in healthcare, they always say like, you shouldn't make your patients your friends or whatever, but
It's hard not
it's
to.
hard not. I mean, the same. We're with people every day, and
Yeah.
I would
It's almost weird
argue.
not to.
I would
right?
argue they are our friends. You know what I
Yeah.
mean? Especially us and the more, me in private practice and you having your own thing as well. They trust us. They text us. They call us.
Yep.
So I'm going to try to help them any way I can. I've had people text me on weekends at like,
Yeah.
midnight and stuff. I won't answer them till the next day, but, at the same time, it's fine.
Yeah.
I'm there for them. I tell people I'm their personal physical therapist. Thankfully, I don't work for a big corporate company anymore, so I could just kind of like, be more hands-on with somebody, and it is
Yeah.
a friendly relationship. And
Yeah, no doubt about it.
if they want help in different ways, I'll do my best to give that to them, as should any healthcare person. But a lot of times, people working in healthcare are too burnt out,
Yeah.
and they are, like I said, working in a more corporate environment. It's almost impossible to have that deeper relationship with somebody. Not that you can't, but it's just harder because they are more revenue driven or financially driven to get more patients in and not care about the person who's in front of you. But again, it's a whole nother topic we could talk about later. But
Yeah, and sometimes they're, as you just mentioned, their hands are tied behind their backs to a certain degree, right?
Mhm.
And we have the luxury of having the time we want to spend with people. And I would argue that most people who get into service-based medical, whether it be physical therapy, doctors, chiropractors, massage therapists, whoever, right, personal trainers, we got into it to help people.
Right.
Right. So it's just only a natural byproduct of wanting to help people, that if you're getting to know someone and you're learning that they're really not sleeping a lot at night, well, it doesn't take a rocket scientist to know that you should sleep more than 4 hours a night. Right. So
Yeah.
it'd almost be negligent on my part, even as just like a person who cares about another
Right.
person, not to mention that, right? Like, hey, you're doing all of these things to pursue, fitness and whatever else is you're doing, but you're not prioritizing one of the most basic fundamental things, when like
Yep.
sleep.
Yep.
Right. And so, yeah, I think a lot of that is just a natural byproduct of just caring about people
Yep.
and wanting to help people. And sometimes that might mean fitness or physical therapy. And
Yep.
sometimes that just might mean letting someone vent about some bullshit they have going on at work.
Mhm.
Right.
And there's a lot of crossover between professions. Like, my stuff bleeds into your stuff bleeds into mine. Everything is like melds together in a way because we're trying to help the person.
Yeah.
So we can't forget that, again, we're a team. We're not just separated. We should be able to call each other, me and you,
Yeah.
text about somebody who's having an issue and collaborate
Yeah, absolutely.
for the benefit of the person. But again, a lot of people, they're too burnt out, they're too busy, they got other stuff going on. But I think people appreciate that extra mile that you're willing to give them
Yeah,
in
there's
terms
no doubt.
of their care, because they're most of the time, especially with me, they're hurting, they're in pain, their knee hurts, their back hurts, their neck hurts.
Yeah.
They might be taking medications that's not working. They might have had surgery before and it still hurts, like I said, and they're frustrated, and they're frustrated with their primary care or whoever because they're not really like giving them the time of day.
Yeah.
And thankfully we're in the position where we could give them more time and even just listen to them, which is huge. I don't know, I say half the time my physical therapy is just listening to somebody, and I don't really do much. Sometimes they walk out like, "Hey, Gerry, I feel better. My knee feels better." And I was like, "Oh." In my head, I'm like, I don't really do anything too fancy or crazy, but as long as they feel better, that's all that matters,
Yeah, absolutely.
Yeah. How's your so okay, we talked about your shoulder, your knee. What else do you have again? I mean, you have to say it.
Let's talk about all my, like, seriously, dude, sometimes some of my clients are like, when when you're 40, you'll understand. And I'm like, when I'm 40, I'm just going to wake up like Macaulay Culkin in Home Alone and just start screaming and I'm going to explode. That's what's going to happen because I mean, I feel good most of the time, but
we got some groans back there.
It's just funny because it's like, okay, people are saying when you're
we're
50,
getting old.
When you're 40, you're 50. I'm like, I already feel like crap a lot 50. Of the time. So I have to work really hard to feel good. So, you know, and part of that is jujitsu because it's just super hard on your body, and I could be smarter.
Brian's in pain right now over there.
Yeah, right.
Oh, when was your birthday?
You survived. Hey, happy birthday! That's really close.
You're good. You sure? All right. But yeah, I mean,
I think he's wheezing over there.
But yeah, so your knee, shoulder, your back. Right?
My back is actually a lot better.
Okay.
Yes, which you helped me with too. Yeah. And so the back one I've noticed is I have to be keeping my hips mobile and I have to be doing core work, like basic core work, right? Like just focusing on stuff like mostly anti-movement based core exercises, right? Yep. Like Paleo presses, planks, stability ball planks, buzzsaw plank, all that stuff that is just going to challenge my core and its ability to stabilize different positions.
Right.
As I've talked to you about before, also not sitting on the toilet for 20 minutes playing chess on my phone.
I was telling somebody this 2 days ago.
This isn't the best thing for your lower back either, right? But
because most of the people I get have back pain. Like back pain is, we call it the common cold of musculoskeletal, disorders.
Yeah.
Because everybody gets back pain. I've seen 12-year-olds with back pain, which is crazy.
It is crazy.
As you know, the range of people getting back pain is insane to me, but. Somebody was telling me something similar because I remember you told me your back hurts, and you told me you sit on the toilet playing chess for 2 hours to hide.
I didn't say 2 hours.
To hide from life or whatever.
Well, sometimes when you have 2 kids and
you just want to get away from them.
And like I say, honey, I'm going to the bathroom, and that's sort of the end of the story. Like I'll be back.
I'll be back in an hour.
That's my version of like, I'm going to the bar. I'll be back. I'm like,
I'm pretty sure you had pain with like more flexion stuff. So of course, if you're sitting like this,
all right, Gerry, calm down.
Playing chess, and you get up like an old man and your back hurts. What do you expect's going to happen? You know what I mean? So again, but that's only one part of the back pain equation. But let's start with that, basic level first. Stop those prolonged painful positions.
I think a lot of it though is that I'm naturally very flexible. Like a lot of my injuries, have been due to like lax joints, right? So even in jiu-jitsu recently, I keep hyperextending my thumb, right? Just it happens, right? And so obviously I could do something to brace it or whatever, right? But I think a lot of my issues have just been almost a lack of stability, right? Almost too much mobility.
Yep.
And so I've found with the back that, yes, I think my hips do get tight at times, but probably the biggest thing is just prioritizing having a stable core, stable spine, because I find that a lot of the times, especially since I can be explosive when I'm doing jiu-jitsu or even in weight training, if I am moving too much through other things and not keeping my spine stable, I find that I'm moving too much through the spine, right? Which stresses the tissues in that area. And so there's as you've always mentioned, right, there's multiple factors, right? If you're looking at a textbook to deal with back pain, you're going to find a great
topic to talk about.
You're going to find hip mobility, core stability, don't sit on the toilet for 2 hours, right? Yeah, so there's different things, right? But you have to keep it all you have to put it all into context.
So many things just went into my head when you mentioned that, because again,
just forget that.
I'm looking at the outline, but I'm like, this is just.
Well, what would be like one good one?
How much time do we have?
I don't know. It's your podcast, Gerry.
Oh, we're good. Okay,
we got 30 minutes.
Yeah.
Do you want to pick one of them?
No, I want to talk about the core stability thing. So, okay. So you found something that works for you. You know? And again, I always tell people the body isn't always a textbook or a research article. You know what I mean? We work with people every day. People are going to present differently than what a research report says sometimes. There's research that always shows like, oh, well, does core stability really help back pain? A lot of times it says no.
Yeah.
But if the movements you're doing and the exercises you're doing are helping you, I'm not going to be like, well, this article says core stability doesn't help. because it's helping you. You know
Yeah.
what I mean? And again, people present differently than what research says. I could explain it a different way probably, but at the same time, you know what? It's working. You're getting stronger. Your pain is desensitizing, as I always say.
Yeah.
That's all that matters. You know what I mean? I don't care what, not that I don't care. I do care. I'm a evidence nerd as well.
Yeah.
But, like I said, I'm a clinician, so somebody in front of me is going to present differently, especially with back pain. Back pain is so all over the place. You know what I mean?
And I would think some of that just has to do with how many things are acting on the spine, right? Like if you're dealing with, like, let's say, for example, your wrist, there's less things that can act on the wrist and affect the wrist than there is in the spine.
Yeah, I mean,
right? I mean,
yeah.
there's muscles in your upper body that affect the spine. There's muscles in your hips and legs that affect the spine. Obviously, the muscles in the core. And just in general, there's a lot of movement the spine can do too, and there's a lot that's asked of it. So it makes sense.
At the same time, there's a tightrope that we have to walk in terms of like explaining back pain. Like people get caught up in stability of things, shoulder stability, back stability. And sometimes when people hear that, they're like, "Oh, my back's unstable," meaning like anything can set it off. You know what I mean? So like,
Yeah.
our choice of words has to also come into effect as well. Like maybe don't say like, "Oh, you're super unstable. We got to work on this because you're unstable." You're stable. You know what I mean? People are stable. If not, they'd be flopping over like a jellyfish or whatever. You know what I mean? So
Yeah.
you're stable. At the same time, our words need to kind of like explain things a little bit better is my thing. So like a lot of times, they told us in school as well is, patient first language, be easy with it, ease them into things. Don't, sometimes in healthcare, you could scare somebody when like, oh, this MRI shows this, you're going to have that forever.
Yeah. And
Sorry.
people just run with that.
And then it's in their head for forever. And again, that doesn't help either. You know what I mean? When they think, oh, my back's unstable, they have that in their brain forever. You know what I mean? And that's also not a good thing. You know what I mean? You can't give people that type of language where it scares them into having more pain sometimes or more anxiety about their original pain they had. So, walking people through the process of, why they're having the pain, maybe using different language to not, cause them to get scared of certain ailments is very important, I think, as well. But
well, maybe you can help me with a little bit of my verbiage because as the resident doctor here and doctor of physical therapy, so I'm an evidence nerd as well, but not to the degree that you are. You've obviously done a bit more schooling than me.
You're pretty nerdy too, though. Yeah.
Yeah. Thanks. I do play chess on the.
That's what I was gonna say. Yeah.
I do play chess as we've mentioned before, but
chess is cool. Yeah.
Chess is awesome.
Yeah. We gotta play. I gotta play you.
That's a big part. Well, be careful what you wish for, my friend.
In person though, not on.
All right, that sounds good.
Let's do it.
So that's part of why I love jiu-jitsu is because there's some chess elements to it. But anyways, one of the things that if I'm connecting with someone for an assessment, right, I'm evaluating them, and they may not be coming to me explicitly for pain, right? But that might be something they mention when we start talking, right? Like, hey, I want to lose weight or I want to just be healthier as I get older. But by the way, there's this knee thing or there's that thing, right? And so they're already there. So, of course, I'm going to go through my steps of like, well, hey, what have you learned about this already? Have you had imaging? Have you gone to physical therapy? Have you done this, done that, right? A lot of people haven't done jack.
That's what I was saying in the beginning. Yeah, people don't know where to even start. So.
Or they're just, it's life. Life is busy at times, right? And so it's just one
very good point.
It's just one more thing to do.
It's a very good point.
Right? But one of the things that, your focus on just kind of, hey, how is your dysfunction manifesting rather than the dysfunction itself, right? And that's kind of what I've been doing too, in the sense that, like, let's say I meet with someone and they talk about how they have back pain, and just for an easy example, and during the assessment, I have them try to hold a side plank. And on one side, they can barely hold it for 10 seconds. And on another side, they can hold it for 30 seconds quite easily, right? The way I approach it with them is, hey, listen, you have your pain, and we don't exactly know why your back hurts, right? But we do know that your pain is manifesting asymmetrically. It hurts more on the left side than it does on the right. And you do, in fact, have one side that is much weaker than the other, right? Mm-hmm. So am I going to sit here and tell you that if we address that, it's going to fix everything? Mm-hmm. I can't say that. Mm-hmm. But even a layman could look at that and go, well, isn't it logical, though, to assume that if we address this, it's going to have some positive impact? So that's kind of how I try to approach it, not from the standpoint of, hey, I know for certain, but hey, let's just be logical about this, right? Like you're mentioning knee pain, and when I put you on a foam roller, you were like a soft foam roller, you were practically screaming, right? Yeah. Do you think it's a good thing for your quads to be holding that much tension? Probably not, right? So again, let's just look at these things logically. We don't need to get too crazy. Right. Like again, like we were talking about earlier, like let's start with simple stuff, right? If you can just address a lot of your knee pain just by hopping on a foam roller for a few minutes before you work out, heck, that's amazing. Yep. A lot of the times it's a lot more complicated than that, but sometimes it isn't.
Yeah. Right. It usually is more complicated than that. It's always like multifaceted, like we talked about, but you can't be throwing a bunch of stuff at clients right away. You know what I mean? Like you said, let's start with this first. And again, rehab is a process. You know, therapy is therapy. Therapy is a process. I don't care what kind of therapy it is. It's a journey, you know. Pain just doesn't go away in one day, whether it's, you know, emotional pain, physical pain. It takes time for your body, your nervous system to unwind those circuits that have been there for a while now. Yeah. And like you said, with knee pain, maybe they have tension because they've had that knee pain for a long time and their body just starts guarding everywhere to protect the painful area. So addressing that first helps, you know, or whichever way you want to structure it, you know what I mean? Whatever they can tolerate at that time.
Yeah, that's a great point because as a physical therapist, you not so much because you do a cash-based and you can kind of do your own thing to an extent, but you've obviously have the experience more with working insurance companies from past gigs. And in a way, it's almost like a flawed system to say in the first place, hey, in 12 weeks, we can do this. Same thing as like weight loss, right? Like, hey, I used to do that when I was younger and I just wanted, you know, I wanted clients and I was bright-eyed and bushy-tailed and super optimistic. And I'm like, sure, we can lose 50 pounds in 2 months. We can do this, right? Yeah. But the reality is we don't know. Because I don't know all the variables that are keeping you from where you need to go, right? Like I don't have a crystal ball, right? I don't know what obstacles are going to pop up along the way. And that goes back to the whole healthcare continuum of us working together, right? Because that's one of the things I love about working with you, like one of the recent people you sent to me, right? If I was dealing with her stuff, there's no way. I would have been so overwhelmed, just been like, that's crazy. I don't know what to do. Your ankle barely moves, right? Yep. But knowing she's worked with you and is currently working with you, it empowers me from the fitness standpoint to say, hey, listen, maybe this is the time where we don't focus a ton on your ankle, right? Yep. And we just focus on having a good time, getting a great workout, modifying activities so you can do it without thinking too much about your ankle because you already think about enough about your ankle, right? And so again, just kind of bringing it all full circle, like I think there's so much opportunity there for us all in the healthcare continuum to work together to help people and maybe get away from some of the language of, hey, there's this short-term window where we can fix you and we're going to make it, and maybe just leveling with people and being more real and saying, hey, listen, you may not like what I'm about to say, but this is going to have to be a lifestyle shift. Mm-hmm. Because if you really want to feel better, you really want to have a lower body composition over time, chances are any approach that is going to be sustainable is going to take time to figure out. Mm-hmm. Because again, logically, if it took you 20 years to get here, do you really think it's going to take 10 weeks to get out of this? Mm-hmm. You know, so
I just told like 3 people this week that same thing because again, they've had pain for a long time, whether it's primarily in my practice, I work with younger athletes. It's the same thing though. They've had multiple surgeries from whatever sport they played, football or soccer or whatever, and they've had that pain for 2-3 years, and then they're getting, they're like, why isn't this? It's helping a little bit, but I want it to be faster. I'm like, well, your body's held on to that pain for multiple years now, 3-4 years. You can't expect your mind, your nervous system, and your body to kind of retrain itself in a week or 2 weeks.
Yeah.
That's not how the human body works, unfortunately. I wish it did. We both wish it did.
It'd be great.
Yeah, we'd be just making people better left and right. But again, everybody's different. It's all individual. But at the same time, you should, when you have that pain for a long time, you should know that it's probably going to be a process. Expect it to be a process, and that's okay. That's I always tell my patients, that's the fun part. It's the journey. We're going to get through this together. It's, we'll make it fun. It's going to suck sometimes. You're going to have your good days, your bad days, good weeks, bad weeks. At the same time, we might have all good weeks. You never know. But as long as the progression is somewhat going up, that's always, a good prognosis, I tell people.
Quick side note, I started smirking because I was thinking about, you're going to get a kick out of this. So speaking of having, like you saying, oh, well, of course we would wish it was that way, right? Like the $1 million idea, right? If we could be doing stuff like that, we'd be like gajillionaires, right? So speaking of being that, this guy calls me like a month ago. He wants me to train his teenage son, right? And the conversation seems to be going well initially. And then on the phone, right? I'm just screening him. And he goes, oh yeah, and also I just like you to add exercises that are going to make my son taller.
Yeah, there you go.
I'm like, excuse me? He's like, yeah, there's got to be something you can do. And I'm trying not to laugh on the phone, but I'm like, I mean, he's a teenage kid, so he's gonna grow. It's gonna be all right. I understand that, but like, do what you can do. And I'm like, dude, if I could make
it's a wizard over here.
I'm like, do you realize if I could make people taller, do you think I'd be talking to you right now? I'd be a trillionaire, right?
And I pull on people's legs a lot for like sciatica or something. Yeah. Not a lot, but sometimes, it helps decompress their spine, their hip.
Yeah.
And if they could get taller from that stuff, man.
And they may in the short term.
Maybe, yeah.
Right? Like just if you do like
loosening up the tension,
spinal decompression techniques, but that goes right back to normal within like a short amount of time, right?
Yeah. But
so yes, Naperville parents, man. they want
it all.
They want it
all. They want it now.
Yeah.
And we do our best to give it to him.
Well, not with that guy.
He just hung up the phone.
He seriously, he just was not enthused about the fact that I was just like, dude, there's nothing that's going to make your son taller other than however genetics planned on him being taller.
Sure.
I mean, maybe we can make sure he's not smashing his spine whenever he works out to prevent growth. But short of that, the good Lord intended whatever he did with that.
Did you ask him how tall his son was? Or?
And he wasn't even that short. He was like 5'6".
I was going to say he's probably like this or something. Okay,
he was 5'6", I think, if I remember correctly. And
how old is he?
I think he said 15.
Okay, yeah. Still have a little spurt somewhere.
He could still have,
or not. Maybe he's screwed forever,
Well, and maybe he'll never grow because of the pressure of his dad.
That too, yeah. He's just gonna do that.
I can't, right? I don't know. It was totally wild. It's just one of those things where I'm on the phone and I'm like, I already know with a 95% certainty that this is going nowhere. And I kind of want to just hop off the phone, but I want to be respectful.
Did it just end?
It just never went anywhere.
Yeah, man.
It's
a good topic to talk about.
He told me to get back to me to schedule, and I'm like, sounds good.
I was going to say, since again, I emphasize working with people on a daily basis is, it's different than just, reading a research article or an article in whatever outlet you look at online or on your phone. How do you deal with people that maybe aren't totally bought into what you're trying to do with them? You know what I mean? Like maybe at first a little hesitant. How do you get better at making them or helping them buy in? Not making them, we're not making people do anything, but at the same time, we have an expertise and we're trying to use that to help people. So how do you get people to, I guess the question is, how do you get people to trust you?
I think I think the irony in getting people to trust you is that if you care less about the outcome, you will more than likely get them to trust you more.
Yep.
Because the more I try to make something happen, like, oh, if I just explain this in the right way, or I shove enough logic down their throat, or if I'm empathetic enough, then it'll work.
Mm-hmm.
The irony in it is, as I've gotten older and more seasoned in my career, I've had the luxury of having a bigger client base and haven't had to worry as much about every single new client who calls me, right? And again, what's ironic about that is now I'm in this place where someone talks to me and I'll go there initially just to say, hey, this may not be a good fit.
Sure, yeah.
Right? Like, I just want to get to know you, and, you know, if it isn't a good fit, that's totally cool. I'd be happy to try to connect with you with some people in the area who may be a better fit or whatever. But like keeping it, like showing them that I care and I'm concerned, but I also am not certain that it is going to be a good fit.
Yeah.
And I think there's something about that disarms people to realize,
this is great. Yeah.
Like, hey, this guy doesn't need me.
Completely agree.
It's kind of like dating, right?
That's what I was going to say.
I don't need you, but
it's the irony of having strong intent with somebody, like knowing you could help them, having that confidence that you can help them. I like to think I could help everybody.
Yeah.
But, you know, is it delusional confidence? Maybe. I don't know. But, I want to think I could help most people at the same time being outcome independent, like you said. And I think that's very authentic when people say that. Like when you're trying to, like dating, like you said, trying to come on too strong. You're like, oh yeah, this is
what are you doing tomorrow?
Yeah,
oh, I'm free.
Even just anybody, just socializing in general with somebody. Like, oh, people can sense when you need something from them, and it's a huge turnoff.
Yeah,
you know, it just in general,
absolutely.
Just generally speaking.
And again, you do. I just want to clarify. I don't mean I don't need you in the sense of like,
right.
Obviously, I just mean that I would love the opportunity to help you if I'm the guy to help you.
Mm-hmm.
Right? If what you want to accomplish and what I'm qualified to help you with are aligned, and how you want to go about it is aligned with how my own personal philosophy, then that's wonderful, right? I'll be very grateful for that opportunity. But I'm not certain that will be the case, right? And
Nobody
won't.
Is, yeah.
But that only we can only figure that out just by going into this with good faith, keeping an open mind, being honest with each other. And then by the end of this evaluation assessment, we'll have a better sense of how to proceed. And I'll be the first to tell you, if I don't think I am the right fit for you, I'm in this to help people.
Right.
I'm not in this just to take your money. If I was just in it for finances, I probably could have chosen a different career path, right? So, yeah, I would say, to answer your question succinctly, the irony in getting people to buy in is sometimes not trying to get them to buy in.
Yep. I don't disagree. Yeah, it's, being, again, the what's the word? The way people say, to just be yourself or just be authentic.
Yeah.
People say, oh, well, just be yourself and people will like you. It's great advice. It's also horrible advice because people don't really know how to even be themselves. You know what I mean? Because they're always trying to be somebody else or worried about what someone else thinks of them or how other people view them. So it's like, it's great advice, but it's also not good advice. But, as you get older and you get experience, you start becoming yourself more and you start becoming more your authentic self. And I think, like we talked about, people connect with that and they know you're being you, and that's okay. You know what I mean? And some people don't like it, and that's fine. But the people that do buy in and do trust your judgment when it comes to, with me, with physical therapy and rehab, with you, training somebody to get stronger for whatever reason, it helps. And it sucks when, when I do see people struggling with that as well, especially in healthcare, like you said.
Yeah.
You need to talk to people like a person that's in front of you, not, a textbook or data that's in front of you. And I've seen that, going through school all my life where people are just like, man, how are you going to help people when you can't even talk to them? Sometimes, not all the time, but you see it and it's like, man, no wonder people think this specialist isn't good or has bad bedside manner, as they always say. I've had patients tell me that all the time. Like, this person had terrible bedside manner. They just dismissed me right away. Like, that sucks to hear. I really don't like that at all. So like, I do my best to just talk to somebody like me and you are talking right now. This is how I talk to everybody.
Yeah.
You know what I mean? I sprinkle in more, rehab and physical therapy stuff within whatever they're presenting with, whatever they're telling me at that time for their PT evaluation. But I'm still me.
Yeah.
And they could joke with me. They could have fun with me. As we're kind of we have very similar values when it comes to that. But I think that's big in terms of being your authentic self, where it takes time, but at the same time, it's people really connect with you that way.
Well, and some people are naturally more gifted with that, but some of it is just, this is a conversation we could go on for a long total rabbit hole, but I would just argue that obviously the main responsibility is on parents to teach kids, but I would like to see more soft skills being taught in schools, right?
Soft skills?
Soft skills is just like the idea that, you're in whatever your specialty is, whether it be being in audio or videography or physical therapy, personal training. You have that. Now, what are some of the other things that are going to help you be successful, right? Like organizational skills, communication skills, like soft skills are just those other things that are going to help you be successful that aren't necessarily specific to your profession.
Gotcha.
Right? And so helping kids, again, I could go on that for a while, but, when you were talking about how do you navigate that situation where you be yourself when you're not really sure who you are, right? Some of that just comes with life experience, right? And in fact, I would argue that's a big part of it, right? Because not everyone is born like they're painting a model airplane and they knew at 6 years old they were going to be like a aerospace engineer, right?
Yeah.
Right? Like sometimes you need life experiences to know, like sometimes to know what you want, you need to know what you don't want. And that just, that can only happen through life experiences, right? And so, and then again, maybe bringing it back to the kids, there's this opportunity where especially nowadays you see with phones and internet, people are just putting themselves out there less and less and less, right? And so they're not getting these experiences to kind of hone their communication skills or help them become more self-confident, more self-aware, and learn about themselves. And again, that's like a whole nother topic, right?
But it kind of, it's still within the realm of wellness because, when you are confident in something you want to do or something you've studied for a long time, you should be confident in it. That's all right. There's nothing wrong with that. You know what I mean? So, and like you said, maybe you have to besides just life experience, you have to push yourself to things in a way. You have to push yourself into situations where it's going to be difficult to find out what kind of person you really are. And that kind of peels the layers of onion or whatever, so to speak, of yourself.
Yeah.
To really figure out how you respond to certain situations, and it makes you more you at your core.
Yeah.
And that's good. You want to have that core confidence, that core yourself, instead of, having all the whatever it is, social media imposing itself on you, or, the media or TV, which nobody watches TV anymore, but the internet influencing you instead of its actually being you. Of course, there's going to be some influence from those outlets, but there's nothing better than just kind of putting yourself in uncomfortable situations and figuring out who you really are.
Yeah, absolutely. I think you'll appreciate this. This is actually very relevant and recent. As you know, I have 2 kids. Jamie is 2 years, 3 months, and Brennan is 5 months old. And with Jamie, my wife and I both are very, I make mistakes and I'm a flawed parent, a flawed person.
Right, yeah.
But it's something that I want to put my heart and soul to. Having my kids is, it's one of the greatest, if not the greatest purpose in my life. And so we take it very seriously. She does a lot of research. I'm super grateful to her that if she's always just kind of learning what she can. And one of the things she picked up recently, and this is intuitive to an extent, but I never thought about it this way. And it plays into what you were talking about with challenging yourself. She was talking about how sometimes the tendency with parents is to want to do things for their kids, especially moms, right? You love your kid and you want to provide value to them and take care of them, right?
Sure. Yep.
But having your kids struggle, having your kids have challenges, having them learn tasks that they can do on their own, like chores, actually builds self-worth because they are realizing over time that they are capable, right? Sure, you're like my son this morning, he's having a hard time taking his shoe off and he's having a fit about it. No. Help me. And I go, dude, you know how to take your shoe off. Just pull the strap. Yeah. And like, I could have just helped him, right? My wife probably wanted me to help him, but I'm like, just give it a second.
Yeah.
But then he figured it out. He just pulled the strap and then he just went about his business, right? Nice. And that's just like a minor little data point that's like in his brain, like, oh, yeah, I can do these things, right? And just realizing you're more capable than you realize. And that's something that starts at an earlier age, right? Yep. Is just putting yourself out there, not being afraid to test yourself, challenge yourself. And that's not a journey that stops at kid, when you're a kid, right?
Never stops. Really.
Even like the first, you've been on my podcast, this is probably my 12th one now at this point, and I'm much more laid back doing it than the first time I did. The first time I did it, before we even started, I was like, right? Like getting those chest and stomach feelings out. And, it was a little more uncomfortable the first minute because I'm just trying to ease into it.
Yep.
But again, if you lean into that, it gets better. If you don't lean into that, it only gets worse.
It's never going to go away. Yeah. Even like you said, like coming in today, I was like, man, these lights are bright. Like this looks like a real production. You know what I mean?
And
you're a little nervous at first, and it is, yeah. But
shout out to Audio Hive.
Yeah, at the same time, it's like now that we're talking more, it's a lot easier. And also, you've practiced this before a little bit, but
yeah,
it's just a whole other thing to kind of dive into. Is when it comes to wellness, is you feel better when you're confident in many different areas in life, and there's nothing that can replace that. When it comes to whatever it is, going to the gym, socializing, a job interview, going to school.
Yeah.
All that stuff will make you feel better the more you put yourself in those situations that you probably don't want to, but in the long run, it'll help a lot. So.
Well, yeah, and I think that's probably one of the most underrated and aspects of my own job, and I think yours as well, that I'm extremely grateful for, is just the idea that in some ways, we're helping people be more human, right? A lot of our clients are people who are sitting many, 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 many hours of the day, right? And have sort of lost touch with our roots as far as being more active throughout the day and knowing how to use their bodies, right? And so I've seen many, many clients become more confident just from working with me, not necessarily because I'm doing anything too special, but just helping them do what they were already capable of doing, right? And realizing their potential and just feeling more proficient just walking through life because
in general,
because now next time I can squat down and grab something off of the floor.
Yep. I can bend over and pick up that pencil that initially popped my back in the beginning that I'm deathly afraid of now, and it's the best feeling in the world. We'll wrap on this, but when someone leaves us and they're like, hey, I feel better, like I said, sometimes I don't even do that much, but as long as they're feeling better and they walk out with a smile, or they walk in or they walk out better than when they came in, that to me is the best feeling in the world. I think so. But
well, and especially with them being in pain, a lot of the times that's linked to fear. And in some ways, fear in itself is not bad, right? Because it just depends on what you do with it. But being scared is like the opposite of confidence, if you really think about it.
Yeah.
Right? Confidence is being able to go into a situation and like you may have some jitters about it, but like you're ready to take it head on. Where the more you give into fear and just live scared, right? That destroys confidence, right? And that's, I think, pain plays such a role in that, right? People just, well, I can't do this anymore. I've talked to so many clients, I'm sure you have too, where the list of things that they could do when they were this old, like in their teens, went from here to here when they were in their 20s, and went from here to here when they were in their 30s and 40s. And slowly but surely, you get to where there's like this small amount of things you can do physically, right? Because you're just afraid to go outside that. That doesn't mean that's the truth, right? But that's where they're at, right? They've sort of shrunk to that. And so, I think it's amazing that you can do what you can do to help people at their worst. Well, I would argue just that you are often more so helping people when they're at their worst, right? Or one of their more down points, right? When you're dealing specifically with pain, and how to navigate that.
And the whole, what's the old saying of fear is false evidence appearing real. Remember that one?
I forgot about that, but I've heard that before. That's good.
Yeah,
False evidence appearing real.
But anyways,
I dig it.
Yeah, that's all we got. So thanks for coming.
That's all we got.
Danny,
Gerry,
make sure to subscribe, comment, like, all that good stuff on YouTube. My Instagram is at APT_Dr. G, just spelled out like that. If you have any questions, you could just DM me on there. And we'll catch you in the next one.
Can I plug myself?
No. No, you can't. Go ahead.
Unplugged.
Go ahead.
My website is DannyGustinFitness.com. I also have a podcast. It's Danny Gustin Fitness Podcast with my co-host Nico Dotto. It's a great
podcast. I've been on it twice.
He has. Every Tuesday. And actually, we're going live, not this Tuesday, upcoming Tuesday, but the following Tuesday. Oh, so if you check me out on Facebook, Instagram, Danny Gustin, you'll see posts about that. And dude, just thank you so much for having me on.
So we'll post these on, a lot of these clips on Instagram, and it was fun, man. Thanks for coming. It was my first guest ever, but
and we got through one of like your 20 bullet points.
I didn't even look at my outline at all. But,
told you, man.
Yeah. All right, cool. See you guys. Until next time. Peace.